Okay, we're recording. How's everybody doing for week 9? Monday of week 9.
Good.
Good.
Okay. How's everybody doing with their HESI preps? They're due on Sunday, right? Okay. How's everybody doing with their vulnerable populations assignment? Due a week from Sunday, right? This is a busy week. You have several things going on. You have your week 9 NCLEX, right? You have your case study. We're doing a quiz today from week 7 and 8 that we missed because of the holiday. There's one other thing. Oh, and your HESI prep assignment is due. And then the other thing is this is exam 3 prep week. Okay, so we have reviews this week. Exam 3, you'll be taking exam 3 a week from today. We already had one review that was this morning with Professor Ford. Doesn't look like it was heavily attended, but I've already sent you the recording. It's in your announcements. So you already have the first recording. I'll be doing mine on Friday after my class. That'll be the second one. And then Professor Kershaw does hers on Sunday evenings. And so, as always, I wait for her to process that review and send me the recording, and I will send that to you Sunday night. So I know you take the exam on Monday if you want to watch that. Okay? Today, we'll do the quiz now. Then before we go through the quiz, I want to go through the big announcement I sent over the weekend yesterday, which is the roadmap for the next 3 weeks. Later on today, I'm going to look at the master HESI schedule for campuses. And hopefully the campuses, has anybody heard from your campuses about scheduling HESIs yet? Nobody's heard about that. I would gather that the master schedule should be in place or almost in place. So I will send you out later on today or tomorrow a spreadsheet with all your campuses and when your HESIs are scheduled to take place on campus. Everybody in this class takes it on campus. So it's just more of an FYI from me, but you'll be scheduling them through campus. I don't have anything to do with the scheduling. I just want to provide you a heads up of when your community HESI would be, so that when you get your other class HESI schedules, you can kind of start thinking ahead, right? Because your HESI is 2 weeks from this week. So I'm going to try and get that to you today or tomorrow. Okay, so at least have an idea when your community HESI is. And then somebody from campus will be reaching out to you hopefully this week to get that scheduled. Okay. So today we'll do the quiz. I want to go through the announcement, the roadmap announcement. Then we'll go through the quiz, try and do some lecture from the quiz, whatever. We're covering violence and human abuse and culture today. This is our last week of content. Then after we finish up with the content, we're going to do a case study, a cultural competence case study that you received in your announcement yesterday at the bottom from me. Okay? Does anybody have any questions? Okay, it is 3:04. So let's do the quiz. I need to allow for extra accommodation time for some students. So we'll start the quiz here in a minute, and then we'll come back at 3:30. All right, 3:30, we'll get everything else started. So don't log off if you want to go off camera after you're finished, but make sure you submit it first. Okay, in the chat, I will put the access code for the quiz, which is my last name. Does anybody have any questions before we get started? All right, we'll go ahead and get started on the quiz. I'm going to mute myself, make sure everybody else is muted, and then we'll see you in about 20 minutes. Sound good? Hey, if everybody could start coming back, that'd be great. Looks like everybody's done. How'd you do? Thumbs up from Charmaine.
Mhm.
Anybody else? How was it?
Good.
Remember, this covered week 7 and 8 content, so it's going back a little bit. So if you did well, that's good. That's good. That's a good sign for exam 3 prep, right?
Yep. And I case study. And I HESI prep.
Hey, just waiting for a few more people to come back on camera and then we'll get going. Are you finding that we'll talk about this in a second when we get back with the big group, but are finding the HESI prep? I know it's labor intensive, information intensive. Are you finding it helpful?
Yes. Yes.
Anybody else? Brian, how you feeling about it? The HESI prep. Thumbs up. Amar, how you feeling about it? Charmel, how you coming on your HESI prep? Good? Okay. All right. Well, I'm going to go ahead and share my screen. Can everybody, whoops. Everybody see this?
Yes.
Yeah. Okay. All right. So I told you, so you guys skipped a week because we didn't have the holiday. I sent you 2 recordings from last week, right? I sent you Professor Kershaw's from Tuesday, if you want to listen to that. And I sent you mine from my Friday classes. Okay, so I know we didn't have class last week, but I would highly encourage you to watch at least my recording. That was a live recording from class. Okay, unfortunately, you guys had the holiday, but you have to get the information some way, correct?
Yeah.
So please listen to my recording from last week for your live content. It covered week 7 and 8. And if any of that information didn't make sense or you need clarification on any of that information, please reach out. But for you guys, unfortunately, week 8 is going to have to be with a recording. Make sense? Has anybody already listened to it? Charmaine, how was it? Was it clear? Did it go through? Go ahead.
Yes, it was clear. It addressed our outline, our weekly outline.
Yep, your PowerPoint. Yep. Now it is always, obviously a live class. You get the chance to ask questions. You didn't. You're watching a recording. So if you do have any questions, please reach out. Okay. But that's how you're going to get your week 7 and 8 content. All right. We start to go through this week. You have your NCLEX, and I'm just going through this because there's a lot. The weeks 9 and week 10 are really busy for PN community. Okay, you have your NCLEX, which is open to do. You have your HESI case study, which please go through your module to complete. Your HESI prep assignment, I hope you're working on it. Okay, you're going to get out of this what you put into it. This is your HESI study guide. Okay, and we'll be doing reviews on the HESI next week. Okay, we talked about the case study for today. Exam live review sessions are this week. So next week, on the heels of your HESI prep assignment, you have your vulnerable populations. Remember, this is an individual PowerPoint project. This isn't a Word document project. This is a PowerPoint. Okay, you can look at week 10, if you haven't already, to look at the rubric to see how I'm going to be grading it. Next week, you also have exam 3. Okay, so I'll be sending out information about that. There's nothing different from exam 1 and 2. Okay, you'll get to download an hour before the exam. Unfortunately, you're a Monday class, so you're gonna have to wait till Saturday for the grades to be posted. Okay, and I told you, or at least in the attachments below, I did attach the HESI review schedule, exam 3 review schedule, and the HESI review schedule. And then I told you earlier, I'll be providing you a calendar of when your campuses are having their community HESI. Okay, preparing for HESI, you have your HESI prep assignment. I'm right here. Reviews of study guides. I would pull out your study guides and all the notes you've taken on the study guides. Your PowerPoints. Okay. And then week 11, you guys jump right in from exam 3 into your HESI in week 11. Okay. But do remember that in week 11's attendance is your HESI. As long as you're taking your HESI, that's your week 11 attendance. Okay. Remember, in week 11, you also have an NCLEX. That's your last NCLEX. I know HESI week is crazy, but remember, in this class, you do have an NCLEX. Okay. Week 12. Week 12, you do have to attend this class on Monday, but it's a very short class. And it's probably going to be a big class because I need to invite my double section Friday class to this class in week 12. All right, because grade books get closed on Tuesday or the latest Wednesday. All right, but you're a Monday class, so we will have class. So you do have to come to class on week 12. It's usually maybe 15, 20 minutes, and we talk about the HESI. We talk about kind of a class wrap up. All right, so in order to get attendance credited for week 12, you will have to come to class. Okay, please note that your HESI remediation is due that Monday night of week 12. I'm going to send you several reminders, but once you take your HESI, I would highly suggest that you just get your remediation done. Don't wait until Monday, June 24th to get it done. Because if something happens, you lose internet, or you can't complete it on that day, by that deadline, something happens, there's no extensions. You'll end up with a 0 for your HESI. So I would encourage you to try and complete it as soon as you can after you take your HESI. Okay? Several attachments, the case study we're going to do today, I did attach your remediation guidelines. Okay, you've seen this before, but just want to let you know, here's the expected, depending on what your hours are on your HESI, here's the expected time for your remediation. Okay, so that is attached. My advice is that you complete as much remediation as you can. Okay, don't just do your allotted hours, just go through the remediation, go through the rationales. It really helps learn. Okay, here's your review schedule with exam 3 and your HESI reviews. All right, so have a look at that so you know what's coming up this week and next week. Okay, I took out exams 1 and 2 so it wouldn't be so busy. Okay. And then here's our PowerPoint for today. Oops. I need to pull that up. Okay. So, do we have any questions about the roadmap? Okay. Let's take a look at the quiz. Okay. School nurse notes several children. Remember, this is weeks from weeks 7 and 8. Okay. School nurse notes several children developing a pustular rash on their faces and extremities following several days of fever and malaise. Which steps should be taken first? What are we thinking here? What concept is this covering? And I appreciate everybody's involvement. What concept was this covering?
Would you have to notify the health, you have to notify the authorities, which is like the health department or so, with you know, the
Smallpox,
potential smallpox.
right? So this concept is covering disasters,
Okay.
right?
Mm-hmm.
Right. So these are the initial potential symptoms of a smallpox outbreak. So the first thing we'd be doing, it's not that the other questions, the other answers are incorrect, but the question is asking, what should you do next? Well, if we suspect anything like a smallpox outbreak or a smallpox exposure, we have to notify the authorities. Okay. So the nurse is caring for an immigrant who is pregnant with her first child. There's no vaccination records available. Which vaccine should be prioritized? And whoever answers this, I want to know why.
Rubella, because it could be potentially fatal to the infant.
Without a rubella vaccine, correct. Go ahead, Clorinda, go ahead and add to that.
He said exactly what I was going to say.
Okay. Rubella has to be prioritized.
Yes.
Okay, the health department nurse is caring for a 16-year-old female with a new diagnosis of gonorrhea. Which education should the nurse provide? Do we all get B right? Why? Why do we want to be reporting pelvic or abdominal pain, especially with a fever?
Oops. It points to the disease,
Mm-hmm.
the gonorrhea,
Mm-hmm.
and it's probably new that she's been exposed and having unprotected sex with the
Mm-hmm.
gonorrhea, and she could spread it.
Exactly. Anybody want to add to what Charmaine said? The occupational health nurse is caring for a client who just sustained a needle stick at work. Which education should the nurse be providing with regards to HIV testing? Why is C the right answer?
Because
anything sooner than that can give a false negative.
Correct.
So that's why you have to come back 3 months later and
That's
see about
correct.
Okay.
Mm-hmm.
Yep. Yep. So return, it can be dormant or not show up for the first 12 weeks, right, Clorinda? Yep. Yep. The nurse is developing primary prevention program for tuberculosis. Which of these is primary? Think about prevention.
When they cluttered up together like that, they're more exposed, like if they was in jail, prison, stuff like that. So
Right.
when you reduce the crowds, it's it's more less of a chance for it to be
exactly
spreaded.
You're trying to prevent. So a lot of students will select A. I don't know if anybody did. What's wrong with A? What is A?
Secondary.
Residents of
The
a homeless
secondary.
shelter.
Secondary, right? Because they're already living in a homeless shelter, so we're screening, right? We already know they're at risk. Make sense? The home health nurse is visiting a client recovering from a right hip replacement performed 8 days ago. The client is complaining of calf and leg pain. Which nursing intervention is a priority? Let's just stop for a second. Let's say this was an exam question. There is a lot of information in this question to be used. What would you highlight?
It was a hip replacement.
Hip.
It was 8 days ago. So that shows immobility. The
Okay.
patient may have not been moving for
Okay,
approximately 8 days. They're
fantastic.
complaining of calf pain. We know as nurses that anytime you have a surgery procedure and you're immobile, it puts you at risk for a DVT or blood clot. So that's why we would check the calf for edema and
Perfect.
yes.
And then what's the last part, Victoria, that's important to highlight? Is there a
Priority.
particular word in there that jumps out at you?
It says priority. Then your nursing
Priority.
intervention priority. That would be your priority.
Right. And everything, does anybody want to add to what Victoria said? She did an excellent job, gave an excellent summary of all the important information in this question. Right?
Mhm.
Post-op, we're at high risk for a DVT, right? Blood clot.
Mhm.
Right? So we've got to assess for edema. Right? So perfect. Great answer. Thank you. Great answer. Home health nurses caring for a client with chronic peripheral artery disease in both legs. Which client education should be included?
Stop
What-
smoking as soon as possible to improve blood flow.
Okay.
Because smoking, the blood flow is not oxygenated because of the smoking.
Okay. Okay. All right. Excellent. And then this is a COPD question. A lot of your reading from the previous week was Med-Surg, from your Med-Surg book, all these complex chronic illnesses. Which dietary modifications should be used by the client with COPD? There's only one right
Rest
answer here.
Starting a meal,
What?
rest before starting the meal.
Right. We certainly wouldn't encourage A. We don't need to do B. And we certainly don't need to do D. Right? And last question. The home health nurse is caring, oh, no, two more. Home health nurse is caring for a client with cirrhosis who lives alone. Which intervention is a priority? What is our biggest concern?
Falling, evaluate the gait and environment for fall risks.
Correct. Right? That's primary. Safety check, safety assessment. And then which food should be avoided by a client with poorly controlled hypertension?
Canned soup.
Why?
Too much salt.
Too much salt. Too much salt. Yep. So how'd you do overall?
It was okay this time.
Pardon me?
It was okay.
It's all right?
Yeah.
Okay. I want to pull up the PowerPoint here. 1 second. Okay. So this week, okay. One second. Okay, let's pull up the PowerPoint. Okay, so today we're talking about human abuse and violence. Kind of a tough subject to talk about. So let's talk about this first. What do we know about human abuse and violence? Well, we know that violence is a maladaptive coping mechanism, right? We know that high levels of violence are tied to health disparities. So let's talk about it for a minute. We know that violence is very common among vulnerable populations, just like abuse is. Violence is typically a behavior that's exhibited about regaining control. It's predictable, thus preventable. In our nursing practice, in our work, we may be taking care of victims of violence. We may be taking care of perpetrators of violence, or we may be taking care of witnesses of violence. I had dealt with a lot of kids in the schools who were witnesses of violence, and we can't forget about them. So whether you're a victim, a perpetrator, or a witness, in all areas of nursing, irregardless of where you're working, schools, hospitals, urgent cares, you're going to be working with different kinds of people that have been affected by human abuse and violence. Okay, so a couple things. People who typically become involved in violence, they typically have had some kind of a previous exposure to violence. Okay, maybe abusers were often beaten when they were children, or they witnessed siblings or parents being beaten. Right, and unfortunately, they learn that violence can be the only way to manage conflict. We know that high levels of violence are tied to health disparities and adverse health outcomes. Right? Chronic stress causes physiological, psychological issues. But when you think of violence, human abuse and violence, what kind of violence do you think about? What are different types of violence?
Physical violence.
Physical violence? Yeah. What else?
Abuse.
Child abuse?
When you
Elder
say,
abuse?
oh, okay.
Kind of violence? Elder abuse, child abuse, intimate partner violence, domestic violence, assault, battery, suicide,
Yep.
violence against yourself. What about kids? Kids who are exposed to violence, whether they're victims or witnesses, they're at much higher risk for developing mental disorders or mental diagnoses, right? They're much higher risk for self-harm, much higher risk for attempted or even completed suicide, much higher at risk for bullying and harassing. Abuse is about power and control, right?
Mm-hmm.
Typically in family violence, it's usually about it's usually the most powerful against the least powerful. And they're usually, violence is perpetuated in cycles, generation to generation. Think about all the families living in economic strain or live in poverty or who are in vulnerable situations. Right? Think about maybe an unplanned pregnancy, unemployment, divorce, marital strain, death of a loved one, infidelity, kids making poor decisions. Think of all the reasons that the risk of violence is increased. the more unstable your family is, whether it's parents and kids, extended family living with them. Think of all the different stressors that put families, individual family members, family units as a whole, increase for violence. Social isolation, okay, contributes to violence. Think about the pandemic. And I know this firsthand because I was in the schools. And the kids were out of school for so long. Social isolation, lack of friendships, couldn't see anybody at their computer. What happened when the kids started coming back to school? A lot of increased mental health issues. A lot. And now we're seeing that full-blown play out in the schools. Victims of violence have symptoms. Kids are prone to headaches, stomach aches, bedwetting, anxiety, depression, withdrawn behavior, maybe inappropriate sexual knowledge or sexual behavior. Abused women, some symptoms, chronic headaches, palpitations, sleep and appetite disturbances, sexual dysfunctions. Okay, what are we required to do as healthcare workers when any kind of violence is suspected?
Report it.
Report
Mandatory
it.
reporters.
What are we considered?
Mandated reporters.
Mandated reporters. Is that only in the work setting?
Mm-mm.
Okay.
No.
That is everywhere, right? Your neighbor, the grocery store, the gym, the park. We are mandated reporters. Okay? Talked about this. Abuse is not about power and control. They're all methods, is about power and control. All these methods of different kinds of violence are about control. Family violence, most powerful, least powerful. We just went through some symptoms, victims of violence. So what we need to take into consideration are kids. What about elderly? We haven't talked about elder abuse. A lot of people work with the elderly. There's some horror stories out there about elder abuse, whether it's physical abuse, psychological abuse, financial abuse, neglect, right? We talked about intimate partner homicide. Typically with intimate partner homicide, there's been a previous domestic violence issue. That's important to know. There's a history. Elder abuse, suicide. Okay. Questions about human abuse and violence. Well, what about human trafficking, another form of violence, right? Think about all the issues we have with that. Cultural influences in nursing, right? What is culture? I actually brought up, where is,
Everything we believe to be true about the world.
I brought up, I love this chapter. This is in your fundamentals book. Okay. This is, you're required to read chapter 14. Okay. A lot of really good information in here about culture. And I did this in my RN group on last Wednesday when we had our last week of content. I love saving culture for the end. because I'm very passionate about cultural influences that we face as nurses and cultural competence. Okay, so I love saving this concept for the end. All right, we know that different cultures have different values, different beliefs, different assumptions, different practices, different preferences. Okay, we as nurses are always going to be working with different cultures, whether it was me as a school nurse, whether it's me as a professor, whether it's you in your workplace, your family, your community, your maybe local groups that you belong to, book club, Bible study. You're going to be with all different cultures, right? So part of our role, one of the foundations of our nursing profession is to be able to provide culturally competent care, right? So we know the culture, whatever your culture is, our culture is developed about our views about the world, right? What do we believe? What does our culture believe is true about the world? It's a set of values, beliefs, and assumptions. It's usually we pick up through socialization in our childhood, the culture we're born into, the culture we grow up into, right? Lots of different cultures have differences, but they also have similarities, right? But we're all unique because we grew up differently and belong to a different culture. Culture can include, and it does include, we have to be mindful of different language, right? Different preferences regard to touch. Do certain cultures like to hug or keep their distance? Personal space, body language, perceptions on healthcare, right? And healthcare beliefs with regards to maybe end of life care or reproductive health, childbearing practices, time orientation, past oriented, future oriented, present oriented, eye contact. This there's a good box here. Goes through. There's a good box for religious dietary practices. Goes through 6 different religions and what are some of their dietary preferences. Okay, developing cultural competence. That's our ultimate goal as nurses. I've been in nursing for 40 years and I'm pretty versed in cultural competence, but I'm still learning. Right? It's taken me a lot of examining of my own values, my own attitudes, my own beliefs, my own prejudices, my own biases. Right? But if I'm able to look at each different person as unique and try and look at the world through their eyes and their culture and plan the healthcare around their culture, have them participate as much as possible with planning their healthcare based on their culture, then you're doing a great job. Okay? What are some barriers to cultural competence? And there are barriers out there. And we all know people who have cultural competence barriers. Stereotyping is one barrier. Prejudice, another barrier. Ethnocentrism, another barrier. This means that you think your culture is more superior than somebody else's. Cultural conflicts is a barrier. Maybe they arise from misunderstandings. Maybe you didn't know enough about the culture, not by any fault of your own, and you pick a food tray for them that has preferences that they don't eat. Okay, there's always going to be cultural conflicts. They're not wrong, they just need to be clarified. Right? And then another barrier is cultural shock, which means you actually do not have the beliefs and values that you could potentially take care of that person. That's called cultural shock. You feel helpless, you feel lots of discomfort, right? In trying to understand competently somebody else's cultural beliefs. Okay, we talked a little bit about some differences. Communication. Communication may be different in different cultures. This is the table I was wanting you to look at. Table 14.3 on page 196. These are common cultural values, practices, and beliefs for some common cultures that we may be working with. Asian Americans, Hispanic Americans, African Americans, American Indians, Europeans, and Arab Americans. This is a summation. This box is a good summation of the most popular cultures that we are going to be working with and some of their values, practices, and beliefs. Okay, so please review that box. There also are differences in personal spaces, definitely family organization and structure. Those will look different amongst different cultures. Nutritional practices, what their values and beliefs are about death and dying. What do they believe about healthcare? A lot of variation about healthcare plans, medications, follow-up doctor's appointments, right? How to treat their illness, right? A lot of their beliefs about health and disease and illness are culturally based. Another difference between cultures is their susceptibility to disease and being familiar with what different cultures are higher risk for what kind of diseases or conditions or exposures. Okay. Let me make sure I've gone through my notes. Nurses must approach each patient as completely unique. This is developing cultural competence, looking at the culture through observation and assessment. Right? You're always observing, you're always assessing different cultural practices and beliefs. If you need to ask, ask. Right? We don't want to be judgmental. We don't want to be stereotypical. The other thing that can help with cultural competency is you're assuming you're a community nurse. So you're engaging trusted members of the community. Let's say you have a high population of Hispanic Americans in your community. As community nurses, we're always doing things in a team. We're always reaching out to resources in the community that can help us. Reaching out to maybe Hispanic leaders in the community that can help us do our community assessments with that particular population, what the needs are, doing a needs assessment. Okay. Non-English speaking. We've talked about this before in class. How do you engage with the non-English speaking parts of the community? Again, seeking out community leaders that can help you start to engage and help and assess with these populations. We always have to maintain an open, objective attitude towards individuals and their cultures. We have to avoid seeing everybody alike, right? We have to do a self-check, right? Being aware of our own cultural beliefs. And we really have to avoid trying to project our beliefs onto others. Okay? We want to be culturally aware. Culturally aware is being cognizant of the practices of that culture. And I'll just read this last, I love this quote. To develop cultural competence, you need to be sensitive to the cultural implications during every encounter. Avoid stereotyping based on race, ethnicity. Ask questions to stimulate your learning about the client's culture. Don't make assumptions about nonverbal cues from clients from unfamiliar cultures. Right? As you're making the ongoing discovery of various cultures, right? This is a priority in our nursing practice. Okay? So cultural competence is the ultimate goal for us as nurses. Many of you have already been working with lots of different cultures. So I would ask you, my question to you guys is, I'm going to stop sharing here for a minute. My question to you guys for the next couple of minutes before I do our case study is, what are you all doing to become culturally competent? What cultures have you worked with? What have you done? How have you educated yourself?
You
I
just do
feel like
research.
with like
Research
healthcare,
that.
you get to see a lot of different like cultures, and like the patients will be like prone to like letting you know what they're okay with, what they're not okay with, and like speak up for themselves, especially if they don't feel comfortable with like a way that you're trying to care for them.
Mhm.
So that's kind of a way to learn as well, is kind of just take that in mind.
Excellent point. Who else? I'd actually like to hear from everybody here. What's your experience with cultural competency or cultural awareness, cultural learning?
My experience, I feel like you have to be self-aware of your own culture and how you feel if someone was to make you feel a certain type of way. So you have to be open to not being judgmental when you are interacting or caring for someone of a different culture. Outside of just verbally speaking, our body language, our can make someone feel uncomfortable. So basically, not being biased, just being open to learn because we don't know everything. People who we are and who we encounter, we may not agree, but as professionals, we have to, kind of be understanding of other
Absolutely.
cultures.
Absolutely. Charmaine.
Um, talking with the patients, trying to get a feel of what it is that you can do to help them understand you as well as you understanding them.
Exactly. Yeah.
It is a really bad feeling. I've experienced that when I've dealt with different patients in different cultures. It's heart aching to not understand what their needs are when they're trying to ask you to do something or tell you and you don't understand what they're really telling you. Or body language is it can be negative or positive, because I've been in a position where I'm like, can you show me, can you point to
Right.
what it is, or can you explain it,
Yeah.
what you want, and it works on the mind.
It does. Maria, what about you? Maria? You're on mute.
Uh, yeah, just like what Charmaine said, it's hard because if you don't understand what they want, then
So what do you
it's
do?
really
What do you do? When you don't understand, what do you do?
you just have to listen what they want you to.
You ask, right?
Yes.
Yeah, you just
You
have to
ask.
ask and listen, and then respect their culture. So
There's
that's
nothing
what
wrong
we're,
with asking. There's nothing wrong with asking. That's how we learn. Yeah, Brian,
yeah,
what's your experience with different cultures?
So you have to pay attention to the culture first. You have to know the culture that you have to know the different cultures, basically. Um, Experience was like when I was overseas, because I was a military guy, did several deployments to the Middle East. Um, the way that they do things there versus how we do things here, you have to completely disregard the way you do things because you're not taking care of yourself at this point. Now you're taking care of them. So you have to do it the way they want it.
Absolutely.
So you have to put your feelings and your beliefs aside to put your patients first.
Yeah, excellent. Thank you. Charmel, what about you?
I do believe, like the other, classmates had said, it's just a level of respect of others' beliefs and values, and with their cultures. Um, Even with delivering, healthcare or caring for a patient, with the care that we deliver, we also have to base their care plan off of their culture and make it, it's there to still be able to care for them, but also a level of respect for their culture as well, and also not pushing our beliefs off onto others, and also our culture. And it's a way that you can approach, a person with, just conversation. When it comes to culture, you can with listening, also taking in more information pertaining to their culture, because we do study these things in class, but it might be other things that we can also learn from just being an
Sure.
active listener before
Great.
giving care or while giving care.
Yeah, Charmel brings up a good point that I don't think I brought up, which is you are obligated to try and incorporate as much of their beliefs and practices into their health plan as you can, as you safely can, right? And typically, most aspects of their culture can be incorporated into their health plan. I mean, there may be things that, I don't know, maybe unsafe or the doctor won't agree to, but all in all, the goal is to incorporate as much of their cultural preferences into their care plan. Right. The other thing Charmel brought up that's a good idea. It's fine to ask. You may know a little bit about it, it's fine to ask, but it's also okay to do your own research about different cultures. Shadi, what about you? What's your experience?
You said me?
Pardon? Yeah, Shadi. What's your
Okay.
Yeah.
Just like pretty much what everybody else said, and just listening and respecting everyone and not being biased and not like rude. Treat everybody the same, regardless of what they believe and what you believe. Because at the end of the day, it's all about them. So
Right.
that's pretty much it.
Okay. Christy, how about you?
Just be respectful and patient. You've got to have patience with dealing with other cultures if they don't, especially in communication, if they don't understand you and there is a communication barrier.
Yeah. Excellent point. Excellent. That's when you try and find your interpreter, right? Cindy already let us know. Guarda, what about you? What's your experience?
Just like everything everyone said, but there's one thing I wanted to add. There's some culture when it's come for eye contact. Some culture is for some culture, if you don't look at them in the eyes, it's disrespect. It's like you lying to them. But some culture, actually my culture, eye contact is like being disrespected. So it's like,
and what is your culture?
That I'm Haitian.
Okay. So eye contact with your culture is disrespectful.
Yeah, like we don't looking at authority or people that older than us in their eyes when we're talking to them.
Interesting. Yeah. Mariah, what about you?
just about done. So what was the question?
We are talking about cultural competency and how you've been impacted by working with different cultures and what you need to do. What's your experience with working with different cultures?
I would say you need a lot of patience. You got to be open-minded, I guess, with dealing with different people that's not from the same, place as you.
Mhm.
Try to change your perspective and even try to share some things that y'all could have in common, I guess, with the cultures or whatever.
Excellent. Absolutely.
Yeah, that's pretty much.
Thanks. There's a lot of commonalities, but there's a lot of differences, but there's also a lot of commonalities, right? Respect is one
Happy
of them.
birthday, Mariah. Happy birthday, Mariah.
Happy birthday, Mariah. Amar, what about you?
Honestly, can you hear me?
I can hear you.
Honestly, I just feel like, not even just a culture thing, because I feel like with like sexuality too, that runs along with culture because uh you have to ask questions and not assume that a person is a certain culture or sexuality because like I've dealt with like people ask me like, do I have a girlfriend instead of saying do I have a partner, like stuff like that. That's very insulting.
Mhm.
So
Yeah.
I feel like being able to ask the right questions would be very needed in that field.
Yeah, being mindful
Yeah,
of the questions you're asking. Exactly.
yeah.
I mean, there's one thing that goes along with all different cultures and all different sexualities, and that's respect, right? Respect. Thanks, Amar. Rafita, what about you?
Um, for me, I think you just have to understand and respect everybody else's culture, and then allow them time to teach you about their culture, just in
Yeah.
case you don't know much about them.
Yeah.
And then because some people, some I can say female, they don't want like male, let's say CNA, to take care of them, so you just have to respect that.
Mhm. Yep. 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 It comes down to respect, right? Sequoia, what about you? What's your experience with working in different cultures?
I think everybody pretty much touched on everything. I don't have nothing to add.
Nothing to add. Hey, Clarinda, what about you?
I mean, I basically agree with everybody. Just having the patience, and when you don't know, don't be biased. Um, like Amir was saying about the sexuality, when patients come in and they are like trans or anything like that, like you don't want to be judgmental and things of that nature. You want to think outside of the box, because no matter what, we all have to take care of everyone. Everyone needs to be taken care of.
Yeah, and asking those open-ended questions like Amar was talking about. And then making no assumptions, right, Amar? No assumptions.
Right. And then I also have to ask something else.
Sorry, did I cut you off? I'm sorry.
No, but I just thought about it. When we are dealing with that community, if they have a communicable disease or STD, we don't want to be judgmental because we never know how they got it,
Absolutely. That's a great point. It's just in general, whether it's a communicable disease or they're part of a vulnerable population, they're homeless, or how everybody has a story for how they got to where they are, right? And that's, yeah. Destiny, you're our last one. What's your take? Or has your take already been talked about? What do you want to add?
I would just say I haven't had to experience anything dealing with the culture myself, but I would say doing further research on different cultures could possibly be helpful. But I agree with everyone and their thoughts on this process. But I do feel like doing research could possibly help you with dealing with these type of people.
Thanks, everybody. That was great. So, in closing, this class is about being in the community. You are a community nurse, public health nurse. Okay. This isn't your pocket of an assignment in the hospital, with your 5 patients or your 10 patients. Okay. This is a whole community. Okay. So you are going to be exposed to lots of vulnerable populations. You're going to be exposed to lots of different cultures. Okay. You're going to be exposed to lots of age groups that you might be caring for in the community, from infants all the way to the elderly. So community nursing is a very broad profession. It incorporates lots and lots of responsibilities for the nurse. We talked about a lot of those this term. Public health nurse, school nurse, occupational health nurse, hospice nurse, vaccination nurse, immunization nurse, home health nurse. We touched on all of those particular roles in the community. Okay. And so I hope we've tied it all together, with culture being really the most important aspect of one of the most important aspects of our profession, right? And we all work with people that maybe have barriers to accepting different cultures. So help them along, raise them up based on what you've learned, right? Sometimes it's hard, but in order for us to be fulfilled in our nursing careers, you are going to, that's part of the after 40 years, that's part of the give back, is how much you do learn along the way, right? And how much compassion you develop, and how much empathy you develop, and how much knowledge you develop. But this is a very diverse world and a very diverse country, and we all live in very diverse communities. And we're all of the clients we take care of are going to be very diverse, right? So it's imperative that you understand the basics of how to become culturally competent. We're always learning. We're not expected to know everything. During every single year in the schools, 22 years, every year I learned about different cultures. It's very rewarding. And you'll be much better off for it as nurses. You will. I promise you will. I'm gonna break you guys out into you guys need to pull up your community case study from your announcement. It's at the bottom under an attachment. I'm going to assign 3 breakout rooms. This is a culture case study. So I think it applies to what we've just been talking about. Okay, so I'm going to put you guys in breakout rooms. Let's room 1, answer question 1, room 2, answer question 2, and room 3, answer question 3. I'm going to a breakout room for about 5 minutes. Okay, and then we'll come back and we'll talk about it. Maria, you going to your room?
But one non-traditional mean like you're not
So if you
protecting
read the
that culture
case,
or including that culture. So it would, like you said, y'all said it'll BP.
yeah, because if you read the case study, it says the primary
Non-traditional,
purpose of
B and E. Okay.
Yeah.
Oh, we back.
Okay.
Right.
That's good.
I guess.
Yes.
Mm. Don't fall, okay?
Working in that community, she probably won't be taking the class. You know what I'm saying? It don't show like a strong desire to want to do it. It's just saying she's attending it because she'll be working around those people.
Guys, come up with your answer yet?
We negotiating right now.
Okay, I'll give you another minute or so, and they're gonna pull everybody back into the main room, okay?
Okay, we'll be
So,
ready by then.
happy negotiating.
Okay.
I really like that case study. Did you guys like that case study?
Mhm.
Yeah.
It's a good one. Reinforces everything we just talked about. Wait for everybody to come back and then we'll review it and then we'll be done.
Never mind.
Okay.
What's this?
All right. Let's take a look at the case study. Everybody see my screen?
Mhm.
Okay. All right. So Nancy's a public health nurse working in a clinic that provides services to the community of Hmong immigrants. Individuals they are applying for immigration visas and required to undergo a medical screening. Primary purpose of conducting these examinations is to determine the presence of communicable diseases, to vaccinate according to CDC guidelines. She's typically the first person to initiate, this public health nurse is typically the first to initiate contact with these new immigrants. She does not speak the same language as the individuals who report to the clinic, but she has access to an interpreter. Fantastic. She is aware that the clients are nervous about seeking care because they are unfamiliar with U.S. health practices, which is typically the case, which is one of those big barriers, right? So the room 1, did you come up with B? Public health nurse is providing service to recent immigrants, should be most concerned with what? Did you come up with B?
Yes.
Yes.
It's one of the original concerns. Okay, she already hasn't. Go ahead.
Hefita trying to get back on the Zoom.
Who is?
Hefita.
Okay, I don't have her in the waiting room or anything. She
She
should
said you
be.
remove her.
Who?
She said you remove her.
Vanessa or
Hefita.
Nope, I haven't removed her. Tell her to come back into the waiting room.
Okay.
Nope, I haven't removed her. Sorry. Mm-mm. Tell her to come back in the waiting room. Okay, you come up with B. So, as we talked about, nurses need to know what specific risk factors are given for any given immigrant population. All right, we know that, here's an example, Southeast Asians are often at risk for Hep B. South Asians are often at risk for Hep B, TB, intestinal parasites, maybe some visual, hearing, and dental problems. All right, so when we're working with immigrant populations, we've already gone through this. Consider how your own background, beliefs, knowledge may be significantly different to those of the people receiving care. Language barriers may interfere with opportunities to provide assistance. Nurses need to understand the non-traditional healing practices. That's another area. Well, we kind of touched on that. Non-traditional healing practices from different cultures. Right? Okay. So now Ms. Chang is a nurse who speaks English and Chinese. She's dealing with new Hmong immigrants who speak Laotian as their primary language, and they are unfamiliar with Western medicine. How is cultural competence demonstrated in dealing with the population? Group 2, did you come up with B and E?
Professor.
Oh, yes.
She said she tried to go back, she can't, and I told her to resign back in Zoom. She said she can't because it keeps saying the host remove you from the meeting.
Okay, I don't, you know what? Let her know if she can't come back in, she can listen to this end part in the recording. Okay, because I
Okay.
want to finish up with the class. don't think I don't recall removing her, so I'm not sure what happened. But let her know she'll get the recording and she can listen to the last 10 minutes on the recording.
Okay, thank you.
How's that?
Well, will she lose time for class though? Will she lose the 10 minutes for class?
No,
That's
she
what she
won't.
worried about.
Nope,
Okay.
don't worry about it. She won't.
Okay, thank you.
She won't. Yep.
Okay, thank you.
Okay, I'm not sure what happened, but no, she won't be penalized for any time. Thank you for letting me know
Okay.
that. Okay?
Okay.
Yeah, Vanessa's saying that it said that you logged her out also.
Hey, I'll work with Vanessa. Thank you. Thank you. Did group 2 come up with B and E?
Yes.
Okay, so demonstrating competence, demonstrating dealing with the population, right? The nurse provides care while paying attention to the individual's beliefs about pain, touch, modesty, eye contact. There's some areas of cultural differences, right? The nurse provides care, or excuse me, the nurse provides care that acknowledges the differences, the way individuals respond to illness and treatment. Okay.
Look at daddy face. Don't put on daddy face. Don't put
All
on
right,
daddy.
rationale. We've talked about this, but let's review it. Cultural competent nurses function effectively when caring for clients of other cultures. Right? So cultural. Okay, I'm gonna have to mute.
It's too late.
Okay, so if you're performing in a culturally competent way, you are delivering effective care. Right? So nurses who strive for cultural competence, respect other people from cultures, and value diversity. Okay.
If you've been searching for a homemade lemon cake with natural lemon flavors and the best.
Sorry, I need to mute. Okay. Okay, let's see. Cultural competence includes, I'm just going through the rationale. Cultural competence includes acknowledging the fundamental differences in the ways clients and families respond to illness and treatment for what might be a response of a more typical Western healthcare response, right? We talked about some of the differences, paying attention to dietary practices, pain, death and dying, modesty, eye contact, closeness, touching. Okay. And then group 3, what did you come up with this? Did you come up with D?
Yes.
Okay. So she's taking the opportunity to reach out and attend a local Laotian culture center so she can learn more about the customs and practices of the community, right? What does this demonstrate, right? Knowledge, right? There's a difference. This is a good rationale for the difference between cultural desire, cultural skill, cultural awareness, and cultural knowledge. This is the rationale. So we know the cultural knowledge is information about organizational elements. She's trying to gain knowledge about attending a local function, right? So the emphasis with cultural knowledge is learning about their culture, learning about the worldview from their perspective, right? The more knowledgeable you can be and having a better understanding of the client's culture decreases misinterpretations, misapplication, maybe miscommunication. Okay. Cultural desire, on the other hand, refers to the desire, your motivation to provide culturally competent care. Do you desire to be culturally competent? Do you desire to learn about other cultures and other practices within culture? Okay, your skill. Are you able to deliver it? Cultural skill refers to the effective integration of your awareness, your knowledge, and able to care competently for these clients. And then cultural awareness is simply being culturally aware, is doing our self-examination, in our exploration intrinsically of our own beliefs and how our beliefs influence our behavior. Okay. So that case study reinforces everything we've talked about in the last 45 minutes. All righty. Does that help?
Yes, Professor Margaret, can you actually upload that case study with the rationales?
Sure.
Because the
Sure.
definitions that we have in our foundations book is different from the definitions that you
Okay.
just provided.
I'll send you the version we just went through with the answers and the rationale when I send the recording.
The
How's that?
recording. Okay, thank you.
I'll be happy to. Yeah. Okay. Does anybody have any questions? Okay, you're not done with me yet. Okay, so we still have a couple more weeks of things to get done. Okay, so please reach out if you need any assistance. Everybody just try and maintain some calmness going into the next couple of weeks. Okay, stay focused, stay organized, get your work done, right? Just do it in chunks. All right. Reach out to me if you need anything, especially about exam 3. Oh, Brian was kicked out too. Oh, I know what I might have done
Yeah, Brian and
accidentally.
Vanessa both messaged me and said they both got kicked out also.
Well, okay. Vanessa wasn't. I'll work with Vanessa, but I may not have closed room 3, but I'll deal with that. But thank you, Christy. Thank you.
You're welcome.
All right. So in my message, when I send my recording message, I will just say to that group, because it sounds like it was group 3. If you didn't come back, if you couldn't come back, please watch the last 15 minutes of class on the recording to go through the case study. How's that? Okay. Thank you. All right. You guys have a great week. Reach out if you need anything. Okay. Okay. Bye.